welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by our presenter, Dr. Pearl Werfel, who's a psychologist and has expertise with successful non-medical techniques that you can use to better manage pain and discomfort. However, she is not a medical doctor and therefore will not be discussing medications and other medical interventions. After her presentation, we'll open it up to your questions and comments. So, Dr. Pearl Werfel, Ph.D., is a clinical psychologist in private practice in San Francisco with expertise in wellness, stress, anxiety, and pain mitigation and multiple sclerosis. She has led groups and workshops for people living with MS for over 20 years. Dr. Werfel is the lead author of Multiple Sclerosis, Advances in Psychotherapy, Evidence-Based Practices, a book for mental health professionals. She was inducted into the National MS Society Volunteer Hall of Fame for Healthcare, is a member of the NMSS Health Provider Council, and is recognized by the National MS Society as a trainer for mental health professionals and a partner in care. Dr. Werfel is also a consultant with Can Do Multiple Sclerosis and a new member of our MS Focus Medical Advisory Team. And thank you so much for being here, Dr. Werfel. I'm going to turn this over to you.
Thank you, Deb. Hi, so I'm here today or this evening, depending on where you are in the country, to give you some idea about how you can help yourself in managing pain and discomfort. And just to let you know, my control of the slides going forward has been a little wonky, so I may be ready to go forward and there may be a delay, so we'll just have to be patient with that because we don't want any more stress. So one of the things we're going to be talking about is stress for a very short period of time because there is a relationship between stress and pain. And it's also really important to know how to think about discomfort because how you think about your discomfort really influences how comfortable or uncomfortable you might be. And then we'll be looking at some interventions and you'll get to play a little bit with them. But before we start, I want you to give yourself permission to get as comfortable as possible. So if you want to change the way you're sitting or laying down, there's a couple of pictures you could look at, but it's not necessary. If it's more comfortable for you, you can listen to this whole webinar with your eyes closed, do whatever you need to get comfortable, or even look at this amazing picture for a moment, which is actually dolphins swimming in the waves. So what we want to do is we want to just kick pain to the side. Now, I would love to be able to tell you by the end of this webinar, sorry about that. That's what I was talking about with the wonkiness. We are going, okay, I apologize for this, folks. I would love to tell you by the end of this webinar, you're going to be able to stand on one toe and kick your foot up and your pain will go. And if that happens, please let me know because I have no idea how to stand on one foot and kick my foot up. But get the idea. We really want pain to go. So here we go. I talked about stress for a moment. And those of you who participated in other stress webinars will know this, so just listen in. There is no research that indicates that stress causes MS. However, there is a lot of evidence that supports the association between stressful life events or chronic stress and increase in MS symptoms. And one of the things that increases with stress is pain. Research also says using some adaptive coping strategies affect the relationship between stress and inflammation. And if you don't know, inflammation causes pain. So what we really want to do is we don't want to get rid of the stress in our lives. We want to know how to handle it better. So unregulated stress can cause inflammation, as I already said. It also can cause sleep disturbance. Sleep disturbance and inflammation cause pain and discomfort. Pain and discomfort cause sleep disturbance. And they all cause fatigue, which puts more stress on your body. So we go right back to the top again. Another illustration is this: stress causes pain, pain causes depression, and that's real. And then depression is stressful. It also goes the other way around. So we want to get out of this circle, out of this cycle. Before we do, I want to give you some questions that you can ask yourself for later. And as you answer these are really good things to bring to doctor or any other professional that might be helping you to look at what part of your body tends to be the most comfortable. We always want to focus on discomfort because that's what calls our attention. It's really important to know what part of our body is the most comfortable, and we'll use that later. And does it ever feel unmanageable? And if so, how often? Really important for a healthcare provider to know this. How often does your discomfort interfere with your daily activities? So, if you would be managing MS much better if you didn't have the discomfort or the pain, really important to know what's stopping you. What increases your discomfort? And how often do you feel like you're not as comfortable as you'd like to be, but you can manage? You can take your discomfort and do it anyway. That's really important to know also. Also, looking at the times of day or certain situations in which you notice that you were more or less comfortable. If you get a handle on this, that can help you organize your day a little differently. And what have you tried to manage your discomfort that hasn't worked? I always ask that of people because we don't want to repeat what already hasn't worked. And it's important for healthcare providers to know that. But the big questions are, what have you done to manage your discomfort that's worked even a little bit? Because if it's worked even a little bit, there might be a way it can be tweaked to be even more helpful. So don't give up on something that works even a little bit. Don't cross it off. Just maybe get some ideas about how it can become more powerful. And for today, what haven't you tried that might help you? There's lots out there, and that's what we want to look at. Maybe some things you haven't tried, or you've tried and it worked a little. So here we are. We are leaving pain. Actually, we're leaving behind discussing pain, and we're talking about pain management. And I want you to enjoy the journey. And you will see what I mean later on when I say enjoy the journey and what I'm talking about. So, everybody wants to know the best interventions. Online, look it up. What is the best way to manage pain? It's always the best. I need to tell you there isn't a best way because managing discomfort is really complex and it is best addressed in a multimodal approach. And that means that not one singular intervention, no matter how amazing it is effective for managing every type of pain or discomfort. Now, those of you living with MS know that a medication that works really well for one person may not work for somebody else. It's the same thing for pain and discomfort. And the really frustrating thing about managing discomfort is that any intervention, whether it be medication or complementary and alternative, tends to lose its strength over time. So it's important to have a whole bag of tools, a number of interventions, and I'll be talking about a couple of them today. So if we look at what is the best intervention, see that bolded? The best intervention is to know a whole bunch of interventions. That's the answer, at least the way I see it. So let's talk about physical interventions. That's using heat and cold. Some people say, what are you talking about? But it can really be helpful. Physical therapy and physiotherapy, I cannot underscore this enough. Exercise and movement. Exercise is really important. And for many people, the more you move, the less discomfort you will have, but you need to know what type of movement, which brings you back to physical therapy. So we have a little poll right here that we're going to do. And I just want to know if you are using any of these to help with discomfort. So heat, cold, physical or physiotherapy, exercise or movement, a real quick poll just to see how many people that are tuned in are using any of these. And then Casey is going to magically tell me or show us what the results are. Me or us. Whoops, what happened? We should not have gone forward. Okay, there we go. Ah, no. There we go. Thank you. We got our poll. We have, coming in. Okay, we're almost there. And I think we're done. So,
Werfel, I'm sorry.
yes.
I was going to tell people, I was going to give them the directions, but apparently everybody knows the direction. I was feeling bad for a second that I didn't tell everyone how to do the poll, but apparently they do know. So if someone does not know how to do that, please let us know. At the very bottom, you'll see the word polls. And if you click on it, you'll be able to take care of that.
And it looks like someone also has raised a hand, but let's look at the results. We have 100% of the people that are participating, or that at least participated in the poll. We have 55% of the people that voted. So 100% of the 55% of the people that are on here today use physical intervention. So congratulations on that. 50% of the people use heat and cold. 36% of the people use physical therapy. That's good. I'd like to see it higher, but that's good. 73% use exercise or movement. That is excellent. All right, really good. Thank you for letting me know. And sharing the results. So we're sharing the results and everybody can see it and stop sharing. Okay, let's see if I can move to the next slide. Casey, I cannot. There we go. Yes, I can now. Okay. Next one is complementary and alternative, which is sometimes known as CAM. Massage, energy therapy, that's a new thing. It does a lot of tapping. Acupuncture, acupressure. Herbs and supplements or CBD oil. So we have another poll that's going out just out of curiosity to see if people have used this, and we're going to go to that right now. And this one, we want to know what you have tried that has helped. So let's see if you've tried it and let's see if it's helped. Okay, it looks like we have people answering this. We have more people than last time. So I will share what people have said. 63% of people think massage has helped. 11% of people have tried energy therapy, the tapping, and think it has helped. 25% of people have tried acupuncture or acupressure and think it helps. Herbs and supplements, we almost have 50% of people that are using this and thinking it helps. The TENS machine, 22%, and CBD exactly at 22%. So this just gives you an idea of other people that are working on wellness with MS and what they may be using and what they may find helpful. It looks like the highest ones is massage, followed by acupuncture. Okay, thank you.
Dr. Werfel, I did have some comments
Yes.
in here that cold exercise, all of those that you mentioned, cold heat, stretching and Norco, essential oils and CBD oil. Somebody said CBD in any form does not help them. So acupuncture helps so much, but it's way too pricey here in South California. So those are some of the comments that came in. I wanted them to be told now while it's relevant.
Thank you. I appreciate that. We are now going to be looking at psychological interventions, and this is my area. So there's a whole big list. Cognitive behavioral therapy, some of these you can do on your own, some of these you need to do professionally. Biofeedback, hypnosis, and imagery, a lot of this you can do on your own. Mindfulness and other types of meditation, progressive relaxation, you can do on your own. Somatic experiencing, you can learn with a professional, but you do this on your own. And something called psychoeducation, where you get an understanding of how the way you're looking at discomfort is affecting you psychologically. And you educate yourself about that. And we're going to be doing a little of this. As soon as my little button appears again down the bottom so I can go forward. Folks, if you could see the teeny tiny little button, it's about this big, and on a white background, I can't see it at all because it's a white button. All right. It's important to look at thoughts that hurt and thoughts that help, which means we need to adjust our attitude. So, how you think has a profound effect on the way you experience discomfort. Thoughts or belief can increase or decrease in discomfort, and that's one of the ways cognitive behavioral therapy works. So I can give you some ideas, and if you're really struggling, this is the time to then think about going to a cognitive behavioral therapist, but I'll give you some of the techniques. We all know that when we experience something stressful, like we're in discomfort, what do we tend to do? We tense up. We tense up against discomfort. Everybody does it. It's the way our bodies work. But what happens when you tense up? It hurts more. So we need to learn how we think. And when we think, when you have a scary thought, you grit your teeth. If you're afraid, we all know this. So we need to learn how we think about things so we don't tense up. We do exactly the opposite. When we're uncomfortable, we want to relax our body. I know, easier, much easier said than done. But let's take a look at it. So absolutes can give you no other options, or you can have thoughts that provide absolute options. This is not rocket science, folks. You could have done this without me putting it up here. I can't. There's nowhere to go with this. Never. I will never be able to do this. I will never be able to go any place without having pain. Here's the other one, people in pain. I will always have this pain, which means if you are living with discomfort, you're not noticing times when you have less discomfort, where it's better, because you're waiting for it to go away 100% before you'll relax. If you're waiting for that, you're going to have a long time waiting, like people saying, I'm not going to do anything about my MS. I'm going to wait for someone to come up with something that'll cure me. And we know that's not a great thing to do. So if you're looking for 100%, you're setting yourself up. But maybe you look for how you can be a little more comfortable. Every time I do this, something happens. That's probably not true, unless you say every time I talk nicely to myself, I smile. But if it's a negative thing, you're setting yourself up. So I bolded these because, hint, hint, these are the ones we want you to check out. I will try. I can. And this is a wonderful one. I wonder if there's another way to do this, another way to think about this. So remember, I told you about the journey. This is where we ask you to get into your curiosity. Is there another way? Is it possible? Can I make this better? So we want to look at something called compassionate listening and observing. Whoops, I didn't mean to do that. It did it by itself. Let's see if I can go back. Thank you. This PowerPoint has a mind of its own, like our bodies do sometimes. Okay. Compassionate listening and observing might sound a little woo woo to people. If you want to come up with another name for it, you can. But what it means is, how do we talk to ourselves? Do we scare ourselves or do we comfort ourselves? So when you're noticing discomfort, do you go into, oh my God, I'm not going to be able to do it, I'm in so much pain? Or are you more saying to yourself, I'm having a hard time today? What can I do and how can I make this easier on myself? Really important, because if you hear how I even changed my tone for the second one, the body will relax. Are you willing to be curious? Are you willing to try something else? Are you willing to be kind to yourself and your body, even when you're frustrated with your body? Even when your body is not doing what you want it to do, are you willing to be kind to yourself? Can you let go of the frustrations and the judgments? I'm not asking you to do this all the time, but just for a bit, especially when you're uncomfortable. Let go of being so frustrated that you're uncomfortable. Take a breath and say, what can I do to make it easier on myself? How can I help myself? And the question, will you encourage yourself? Will you do that? Can I make this go forward? Yes. So, what we're going to do is, I want you to practice with 3 different mind body interventions, and then we'll have a chance to talk about them. One of them is mindfulness, and we're going to do a really short experience with mindfulness. By the way, if you're interested in mindfulness, all over the internet, lots and lots of free things. There's also mindfulness based stress reduction, which is often offered at medical centers, and it's usually either very inexpensive or free. Somatic experiencing is based on somatic, the body, and how we experience it, developed by Peter Levine. And if you look that up online, you can get some information. They have some free little YouTubes that are available, and imagery and self hypnosis. So we are going to the experiential part. And after this experiential part, you'll have a lot of opportunity to ask questions. But right now, I want you to be with me for about the next 10 minutes or so. So here are your choice is, sorry, you have several choices. One, you can choose to keep your eyes closed the entire time, make yourself comfortable. The other thing you might want to do is look at this picture of the rocks that were placed by the balance artist and the ocean. Or you might look at something else, another picture that you might have right in front of you in your room. No matter how you do it, there's nothing right or wrong. We're going to start with the mindfulness. And what I'm going to ask of you, this is where you all get to personally like me or dislike me, because I'm going to ask you to pay attention to some discomfort. And I know you don't want to do that. So sorry. I can't hear you, so if you want to curse me, you can. So for just a moment, I'm going to invite you to get into your body. What happens when we pay attention to our body? We notice what doesn't feel comfortable. And we need to notice what doesn't feel comfortable in order to do something about it. So, most people find it easier to do this eyes closed, but you also have the option of looking at this picture or something else. I want you to pay what we call light attention, which means not over focusing, but kind of just noticing your body, just doing kind of checking in with your body and noticing if you're feeling some discomfort, some comfort. See if you can notice the places that have comfort. See if you can notice the places that have discomfort. Not forgetting to breathe. We always want you to breathe. Breathing in and breathing out, and just noticing. As you're noticing, I want you to notice what you're thinking. What thoughts are coming up? Are they kind thoughts or are they cruel thoughts? Are they angry thoughts or are they loving thoughts? No judgment. Just really, really important for you to notice what thoughts come up when I ask you to notice your body, to notice your discomfort. And as you're noticing the thoughts, remember what we just talked about, thoughts that hurt and thoughts that heal. If their thoughts do not feel comforting, like I hate that I'm doing this right now, why am I doing this? See if you can get into your curiosity. Okay, let's try it. I'm here. If any frustration comes up, see if you can look with wonder at a place that might be more comfortable. Simply playing with the thoughts and changing your thoughts. All we're doing is observing your thoughts as we get into your body. Your mind is going to want to think about what you have to do after this, what you did before this. Gently bring yourself back with your breath to noticing your body. And you are perfectly welcome as you're noticing your body. If you notice a place that's particularly tense and you have the ability, please very gently relax that place. Like if it's shoulders, very gently bringing shoulders back. If you notice that your breathing is tight, you can certainly ease your breath, not to do it any special way. This is simply observing. And seeing what happens when you have no other instructions but to notice how you think about your body when you're invited to just check in. How often do you get to just check in, notice your thoughts, and give yourself permission to have a kind thought? Give yourself permission to be curious I wonder if there's another way I can think about this. And I'm just going to give you another minute, but I won't talk. Give you a minute with me not talking, just to see what thoughts you might observe as you're noticing your body, and to be curious if there's a kinder way to think about yourself. Now we're going to move into another way of working. And I just want to let you know that this particular exercise is most helpful if it's done 5, 10, 15 minutes instead of the couple of minutes we had today. And if you're able to do it a number of times, you will begin to catch those not helpful thoughts and begin to change them to something that might be more helpful. Remembering that when we think nicely about ourselves, when we give ourselves options, our body relaxes a little more. It's easier for us to go about our day. It's easier for us to just be because we're not tightening up or bracing ourselves against difficult thoughts. So, staying in the same position if it's comfortable or moving your body, we're going to move from this into something called somatic experiencing, developed by Peter Levine. Again, this is somatic, the body, how you're experiencing your body. If you're really appreciating the mindfulness exercise, you can stay with that. Those of you want to try something different can come with me to somatic experiencing, bringing your curiosity, being on this journey. So, what I'd like to invite you to do in tuning in to your body, I want you to see if you can find the absolutely most comfortable place in your body. It might not be as comfortable as you want, but the absolutely most comfortable place. For some people, it may just be their hair, or the tips of their ears, or your nose, or a finger or toenail. Find it, it's there. There's always a comfortable place in the body. If you're not in the middle of having a heart attack, there's a place in your body that's comfortable and settled. Find it and just focus on it. Notice it. Breathe with it. Appreciate it. Your mind will naturally want to take you to a place in your body that's not comfortable. Gently bring your focus back to the place in your body that is most comfortable. breathing into it, letting your brain know that even though there is part of your body that might not be that comfortable, there's another place in your body that is comfortable enough. And as we know this and notice this, our body begins to settle a little bit. Our brain begins to notice that our body is settling and helps us settle even more. Focusing on the most comfortable place in your body. And now for just a moment, I'm going to say to your mind, okay, you can notice an uncomfortable place and then bring your attention right back to the most comfortable place in your body. And if you want to, again, notice that uncomfortable place and bring your attention right back to the most comfortable place in your body. And some of you might want to stay with this, like a gate going back and forth, or a swing, or a ping pong ball or a tennis ball, focusing for a bit on the discomfort and then taking a breath and coming back to the comfort and focusing a bit on the discomfort, taking a breath and coming back to the comfort. Some of you might want to stay with this. I'm going to move on to yet a third intervention, a third tool. Knowing again that this takes some practice. So if you want to really do this, you would do it for a longer period of time. The last one is imagery. Some people love imagery. Some people love playing with it, others don't love it so much. You're welcome to join me with imagery, or you can stay with one of the other two interventions we were just doing. For those who want to move on to imagery, some choices. I want you to think of something that is very comforting to you. Could be a color, could be water going, could be a rainbow, could be something soft. You don't have to see it, just think about it. Something that would feel comforting. Something that would feel comforting for you to place around a place in your body that's uncomfortable. Some people like to imagine that there is water flowing past that place in their body and it's washing away some of the discomfort. Others like to imagine that there's something really wonderful and soft in a certain color wrapped around that place that's just bringing in the color, immersing it with comfort. Some people like to imagine their whole body just floating on water or a cloud or any other thing that comes to you. To give you a couple of minutes, because as you think about something healing and pleasurable, whether you've ever experienced it or not, your body will relax and your brain will tell your body it's okay. You can relax. Thinking of that image Or you can use the image that's on the screen in front of you if that feels good to you. Just playing. Some people like a color, some people like a number of colors. Again, you don't have to see the image, just imagine it. And see if imagery, this way of self-hypnosis, this is one of many, many ways. If you can imagine it, if it has a color, see if you can get as detailed as possible. Is it bright or is it muted? Can you hear in your image? Does it have sound? And just staying with this for a moment. You can come up with your own images. But again, all over the internet, there's imagery for many, many different things that you can find. You can even imagine a time that you were very comfortable and just let your body remember that. So one more minute, I'm going to stop talking and let you be with this. And then we'll have some time for questions. One more moment. Okay, I'm going to bring you back because I wanted to allow lots of opportunity for questions and comments. If you wanted me to talk more about something. So Casey, I think we don't need the PowerPoint anymore. And I'm wondering, I keep on seeing Deborah. Can they see me or are they seeing Deborah?
They're seeing you.
Okay. I'm just seeing a blank screen right now. Now I'm seeing you. Oh, there we go. There's us.
There you are. That was
So
wonderful.
I'd really like to hear from people. Instead of doing a poll, I left lots of time for people to be able to ask questions or make comments or say, I want more of a little bit more of something that I mentioned to really give you the opportunity to participate.
Know that Teresa a little bit ago said that she lays down and breathes from her abdomen and it relieves some of her pain.
Wonderful. And I'm so glad you found something that helped you. Really good to know.
And then someone mentioned, Alana mentioned hypnotherapy. It really
Mm-hmm.
helps her a lot. And that if she's open and willing, I guess it's all about if you're open and willing, regardless of what you do, right?
Absolutely. And hypnosis is amazing. There are so many hypnotic pain techniques. And I've used so many of them with my clients. I mean, the imagery is just the beginning of it. But if that's the way you're going, you can learn this and you can do it for yourself, the self hypnosis.
Mhm. You know,
Absolutely. And it's fun. I
one
want to
of
tell you the first time I learned imagery many years ago. By the way, I was diagnosed with MS many years ago, and I learned all of this to help myself before I began teaching it. And when I first did imagery, there was somebody talk about woo woo. It was purple and the crystals, and she talked like this. I was laughing so hard at her, but you know what? I was happier and comfortable after that. I thought, okay, it's not really what she where she was taking me, but if you want to laugh at it and make fun of it, great. That's also really good for increasing comfort. Deb, I'm sorry, you were going to say something?
Okay. Yeah, because let's see, back going about let's see, a few messages back, someone had said acupuncture, and
Yes.
I know that that helps a lot. I went for acupuncture years ago because my doctor asked me to do that, and I got absolutely nothing out of it, which was so disappointing because everybody tells me how much they got out of it. So I just wanted to share with you that I guess not everybody experiences the same thing, right? It's not all as positive as people, but the majority of people do get a lot out of it. So I wish that everyone would at least try it if that's something that they're open to. So
Acupuncture can be amazing. I would say to you, if it didn't help you, you might want to try someone else, because I went to acupuncture when I was newly diagnosed 3 times a week. And I was going for years at 3 times a week. And you can find clinics. I was a student then, and I went to a clinic. And it was actually set up to help people detox, addicts detox. But I went into them and I said, will you please help me? And they said, yes, we will. They loved having me. I was like the only patient that wasn't getting high. So and she loved. So there are ways, there are resources in community, a lot of resources for acupuncture. And it can be really wonderful for sleep, for discomfort.
yeah, that's
Definitely.
probably a good point in any of these types of therapies, because if it doesn't work the first time, perhaps you can try it with someone else another time and get a totally different response from your body, right?
Yes. And a lot of this is, like I said, available through YouTube. Some of these are available through YouTube's. Try something else. Try it in a different way. I have a philosophy: if there's no side effect and it doesn't cost very much money, why not try it?
I agree.
Because, go
uh,
on.
Crystal said that she's been trying the Hypnosis 7 series, but her brain won't stop thinking about stuff. And she's asking if you have any suggestions for that.
So, this is the same thing. Thank you so much for bringing this up. This is the exact same thing that people say about mindfulness. Our brains want to be in charge. And I will tell you, I have talked to people that are the experts with this, and the same thing with mindfulness. Extremely well known mindfulness teacher, written lots and lots of books, talked about being out on his porch trying to do mindfulness and do his imagery. And the neighbor had gotten a new dog, and the dog wouldn't stop barking. And he could not get his mind to stop thinking, I wish that dog would stop barking, then I could meditate. I wish that dog is interrupting my imagery. It is completely normal. Just notice your mind wanting to take over and then come back. And noticing your mind wanting to take over and then come back. And so sometimes the hypnosis, you need to change the script or find something else that's really compelling for you or really interesting for you. So, and I've had people tell me, oh, I was thinking through half the thing, but it didn't matter, because when I asked them, how are you feeling? They still said they were feeling better. Even if you're half listening, you're going to more half relaxed than you were before. I think I said that right. At least a little bit more relaxed. 50%. There we go. 50% more relaxed.
Right.
Thank you for that. Great questions. Other comments and questions.
Janice said, how long does pain relief last after you have done hypnosis or the other techniques?
Wow, that's a really big question. There isn't one answer to it. And here's why. If you have done something like hypnosis or something else and your mind starts being trained, which happens in hypnosis, that when you feel discomfort, rather than tightening up, you relax. It's one of the things you change yourself. You can have much more process. So once again, we're not going for zero. Now, some people that are taking pain medication, when they pair their pain medication with an image or with hypnosis, find that then the hypnosis itself later on can be, and there's been research done on this, can be more effective. So I would say if you're taking any pain medication, don't just pop it and go on your day. Get into your relaxation, take the pain medication so that your mind associates that relaxation with the pain medication. So it can work. And for some people, they find their discomfort much more manageable ongoing because they keep on coming back. So it's not like you get hypnotized once and it's gone. Kind of got to keep up with it because our minds want to get back in control again and say, oh no, I have pain. Alert, alert, alert.
Good information. Robert said self-hypnosis has lowered his standard pain level from 5 to a 4, which is 20%.
Excellent, excellent.
Yeah.
That's really, really good.
Let's see. We have Stephanie, well, actually, Mildred had said, could you define a somatic system again?
Okay, so we're talking about somatic. I think we're talking about somatic experiencing. Somatic is a word that just refers to the body, like how the body works. So it's named after how we are experiencing our body. That's why it's called somatic experiencing. If that's what she was asking about. At one point in the stress in the past, I've talked about the autonomic nervous system and that fight flight, but I don't think that's what was being asked. And maybe if I didn't answer it, you can put it back in the chat and be a little more specific. Thank you.
Stephanie says that mindfulness meditation with Glenn Harold on the Insight Timer appointment, or app rather, there are so many free meditations. So like you said, they're all over. That was nice. Heather said, I really enjoyed the 3 different methods of mindfulness you shared. I've been in a massive amount of pain for weeks, not being able to relax. These methods really helped. Our backyard is full of wild strawberries, and it brings to mind the Beatles song Strawberry Fields Forever. And she imagines walking barefoot through them. How nice.
That is beautiful. I would say, what was this person's name again?
Heather.
Heather. Heather, keep it up. Because like I did each one of these with you for less than 5 minutes. In general, they're 10, 15, 20 minutes. So if you really like something and if you like what you're coming up with better than what's you're seeing in YouTube, record yourself. Then you can just lay back and have it for yourself or have someone else that you think has a great voice record it for you. And that's really easy to do. Anyone that has a phone can record themselves.
True.
So keep it up because if you're getting that much from this little bit, I think this may be your way.
Mm-hmm.
I'm so glad to hear that. Thank you for telling me.
So Stephanie just put in that Glenn Harold is a hypnotherapist. So Casey said, Monique on Facebook says, this was very helpful. I will admit I couldn't get my focus off my pain, even though I felt relaxed.
Excellent. So again, I'm going to say the same thing I said before. When I do this with someone, like with one of my clients, We're doing this for over half an hour. And I keep on checking in and saying, is this working? What are you noticing? And we adjust it. You can do that with yourself. So some of the things on YouTube where it's going, you're saying, wait a minute, this isn't working for me. Stop it, get yourself back, turn it back on again. So it's not like I'm failing, this isn't working. Adjust it however you want. If it works for 5 minutes and then your mind wanders, again, get your mind back. And when I record things for people, I say, if your mind wanders or you're uncomfortable, stop it and come back to it in a minute or two. So, yes, sometimes your mind will wander or discomfort will pull you. Keep up with it. Good.
Dr. Werfel, I find that for me, and I'm sure many people, and I'm sure some that are on here as participants, can agree that it's not easy for some of us to just relax.
Of
And it
course.
doesn't matter what the technique, it's just my mind is going to 1,000 different places, and to relax is a miracle to be able to do that. So I think the key is just doing it over and over again, for me at least, just trying over and over and finally seeing a little tiny bit of advancement. And then once you grab onto it, you say, oh, that's how that worked. But I can never just relax. I can never just, even while you were doing it, I was like, okay, Deb, don't think about what's going on here. Don't, like, just trying to focus on that. And I know that I'm not alone. I know that some of those people that are with us.
Absolutely. So if I were talking with you, I wouldn't say don't go there. I would just say, okay, notice your mind going there. Gently bring it back. I don't ever tell people to relax. Tell me to relax, I'm going to stiffen up. It's not about relaxing, it's about making it easier and easier. And for some people, sitting and doing something does not work. For some people, they have to move a little bit, put on some music and go with the music. They need that kind of thing. Other people tell me the only time I can get my mind to shut up is when I'm in a swimming pool or whatever it is. I was like, great. And then sometimes can you remember what it was like to be in the swimming pool? Oh, we can do that for 5 minutes. My mind just shut up for 5 minutes, just like in the pool. Whatever it is, you are not wrong. Find a way that works for you. And yes, expecting busy people to just relax doesn't work. So just notice that you're not doing anything wrong. The mind just wants to take over all the time.
And I will tell you, although Crystal just said, yes, that's her too. She's got the same thing as me. So I'll tell you, for people like us, Crystal, that can't really just relax, once you learn to do it, it's glory. I remember I started to walk, and I never allow myself to be alone really with my thoughts and doing all that. So I started to walk, and I wasn't walking with anybody else. And all of a sudden, I'm all by myself. And I thought, okay, let's start thinking. And it made me cry. It brought back some thoughts that I wouldn't have left myself have time to do. Like, I wouldn't have thought of that. But once I realized, wow, this is pretty cool. Like, I can walk by myself and think by myself without everything else. And even crying was kind of fun because you got to get all those feelings out. So I know that this is going to help people once they learn to relax and be with themselves and concentrating on whatever it is that makes their pain go away. These are wonderful, wonderful ideas. So
The other way to do that is for people that go outside. Now that we can go outside again, there's something called a moving meditation. So whether you're walking or you're on a scooter, what you want to do is if there's trees, focus on the tree, focus on the color, focus on the really ugly color your neighbor is painting their house, or the strange car, the ugly looking dog, whatever it is. You can tell what neighborhood I live in, the funny looking dogs and the people with, as long as you can focus on that, that's a form of meditation because you're not thinking, and your body will begin to relax because this is humorous, or this is interesting. I wonder what kind of flower that is. Whatever it is, even if you live in a very urban area, there is always something to notice. And as long as you're away from the thinking, your body will begin to let go. So, however you do it, whatever works for you.
Heather has a good point. She said it's never easy for her to relax either. There's constantly something going on, chaos. It's honestly like she doesn't have time for MS to get her down. I like
So,
that.
the thing with chaos is you can stop for a moment, you can notice the chaos. And if you're a sound person, chaos is loud. It's like a heavy metal band. So one of the things you can do is you can hear the chaos in your head and you can say, I wonder if I could tune that down just a little bit. I wonder if I can slow that down just a little bit. Could I turn heavy metal down to, I don't know, jazz? I don't know. Could I take jazz and begin to play with it? Whatever's going on, instead of saying, oh no, I can't do this, get really curious and play with it. We used to do this as children. We forgot. Children are great. Children do not have problems with this at all. If they can't do it one way, they'll just try another way. So play with it and hear that chaos or see the chaos, play with the chaos. And you may never get your mind to be totally quiet all the time. Most people can't and don't need to. All that matters is you're not intense with it, and that gives your body some space.
Mildred has shared something very personal with us, and I thank you for that. She said she's thanking you so much for the helpful techniques. She was just recently diagnosed with, she was diagnosed with breast cancer recently. So chemotherapy has added even more pain.
Mm-hmm.
She found that laughter really helps her.
Absolutely.
Mhm.
Absolutely. And I am sorry to hear that. What a challenge. And there are a lot of resources to help people that have been diagnosed with cancer that are undergoing chemo that can help with the discomfort also. Some of the imagery for health and healing was originally done in the studies with people with breast cancer.
Great. Casey said that she finds that it helps her to give her brain something to think about. For example, I think about what the pain feels like and do the opposite. If I feel like my back is tied up in knots, I focus on imagining myself untying a knot on each of my vertebrae. If I feel like my bones are scraping against each other, I just imagine soothing oil spreading between them.
So this person was Casey. Casey, you are into advanced hypnosis. Absolutely. You feel the pain. How does it feel? It feels jagged. Can you soften it just a little bit? It feels hard. Can you expand it? Can you contract it? Begin to play with it and change it. That's wonderful. And all of this, there's been a lot of research on this. It really gives the brain, remember, the signals come from the brain to tell us that alert, oh no, pain, pain. Pain medication, all pain medication does is it disrupts that signal. It blocks the signal, so we're not in alert anymore. We want to get out of alert. We want to say, okay, the pain's there. Okay, and when you're in that place, you begin to feel less discomfort. Really good.
I think we can all agree with Crystal, who says, thanks, this has been really great and really helpful tips. So I agree with you, Crystal. Yeah. You know what? Let's give it one more second in case somebody else has something. Do you have a couple seconds to hang out with us?
Sure. We have a bunch of, did we get all the comments in the chat? We have so many comments in the chat.
Yeah, those are the ones that I've been
Sure.
reading.
Thank you so much.
Casey, I don't think I've missed anything that you can, if you see any, nope, haven't missed anything. Okay, we'll give everybody 30 seconds if you can think of something. Yep, Heather said thank you so much. Yep, everybody seems to be leaving here, I'm sure, with some helpful tips. So, okay, let's go from there. Thanks. This is all the time we have for now. If you've missed any part of this conference, it will be replayed on msfocusradio.org and available on demand on our MS Focus SoundCloud page or even our YouTube page. Remember to follow us on MS Focus on Facebook, Twitter, Instagram for times and access information. Our next teleconference will be this coming Wednesday, 2 days from now, September 29th. That's going to be at 5:30 p.m. Eastern Time. This next presentation will be in honor of Hispanic Heritage Month and will be featuring Augusto Miravalle, MD. He will be discussing maximizing brain health in MS, and the presentation will be entirely in Spanish. So if you know anyone that would benefit by this topic and requires or prefers Spanish as a spoken language, please direct them to our msfocus.org website or our YouTube channel to register for the event. Our sincere thanks to all of our attendees for your participation, and especially to Dr. Werfel, who was kind enough to take time out of her busy schedule and to share this information with us. Before I say goodbye, I just wanted you to know that there was somebody, Alana said, money is a lifetime stressor. So, that's all part of it. I didn't want to leave without you knowing that, but thank you.
Absolutely it is. Thank you everyone for tuning in and for being willing to be curious along with me.
Thank you. We hope to see you again. Good night, everyone, and we hope to see you next time. Bye.
Bye-bye.